This conference will now be recorded.
Hi, I'm Dr. Annette Cargioli, the forgiveness doctor, and today I am with Alex, and Alex is going to do her first session of EPT. EPT stands for Emotional Polarity Technique.
Mhm.
EPT is a completely different approach in emotional health care. Instead of using traditional talk therapy, that kind of thing, or medicine, which a lot of people use for emotional health care, they go and get drugs. Instead of those two approaches, EPT relies on the science of forgiveness. And what it does is it identifies what is the root cause of what is messing with my life right now, wherever that is in your past. And then we find out what the conflict was that your brain keeps trying to resolve, and we resolve it with forgiveness. So
Okay.
that's how it happens. Along the way, I will be using some brief body points. I want to say this too. People who show up for EPT in person and people who do remote EPT, there's benefit for both, but there's about 80% of EPT is absolutely the same online, remotely, or in person. So and I may mention some of the differences as we go along. So I use magnets. If somebody does more sessions with me online even, I pretty much insist that they get some magnets, but we can do EPT without magnets to a certain point. And then when we want to go further, we just use magnets. So these are my magnets. And when I'm doing this online with someone, and they have magnets, I just instruct them where to put them. Whereas if I'm in person, I actually show them and I help them with that placement. So that's
Mhm.
just one of the differences.
Okay.
So all that being said, what is the big symptom, or what do you have going on that you want to change, Alex?
I have pretty debilitating anxiety.
All right.
Um,
And let me ask first, is this
mhm.
anxiety been around like your whole life?
It started on my 25th birthday, the day before my 25th birthday. So about 6 years
And
ago.
you knew when it started.
Hmm. I
Like
did. Yeah,
up until that point, you had never experienced anything like this. Did
exactly.
you just think it was a panic attack?
No, I felt like I knew what was coming. I actually was sitting there watching TV with my boyfriend, and I looked over at him, and an anxiety commercial came on, a medicine commercial. And I
Uh,
looked at him and I was like, I think that's what's going on with me. And he actually called the doctor and I got in there. I prefer not to use medicine, and that's why I've came to see you. But
does the medicine work?
yes, but I'm also on 3 different medicines and
For the
I,
anxiety?
for the anxiety. So I feel like some of it doesn't work.
So did they just keep adding on,
Hmm.
and
Yeah.
then they ended up with the right cocktail?
Yeah. Basically, one's for depression, one's for anxiety, and one's just to calm my nerves.
Okay, I'm writing here. So let's
Hmm.
see. So you're on an antidepressant, right?
Antidepressant, anti-anxiety, and a
Uh-huh.
nerve blocker.
So um all right, all right. I won't ask all the details. I just know it's a nerve
Hmm.
blocker.
Yeah, gabapentin.
Oh, I was thinking
Yeah.
I was thinking an anti-seizure medicine.
Yes. Yep.
Okay. All right. Wow, you're on all three?
Yeah. Yep. And I would love to not be on
Do
any,
you do you
but
take so even though you take this medicine daily, you still suffer from debilitating anxiety?
so I got on the gabapentin 2 months ago, and
Uh-huh.
that's when I was finally able to get pregnant. So that was only introduced 2 months ago. Since that introduction of gabapentin, I've been able to be in the moment. I've been able to be more present. So I would say the last 2 months have been wonderful.
Wow.
So I
So,
talked to my psychologist in lieu with my OB doctor. I
yeah.
am pregnant, so I wanted to make sure all that medicine was okay. And my psychologist basically said he doesn't want to change anything until the second trimester, just to make sure nothing is off whack.
Wow.
Yeah. Yeah.
Wow.
Yeah.
Wow. Wow. Oh my God. Right. I mean, in my head, I'd be thinking, well, it looks like the gabapentin, the anti-seizure medicine, is like better than anything else.
Right. Right. Definitely.
But he doesn't know what the cocktail is doing, so he's just hanging in there.
Right.
All right. Okay. Well, I should have asked you this, but I will ask. So we are gonna post this on social media and YouTube, and I need to get your permission that it's okay.
Okay. That's fine
Perfect.
with me.
Okay, perfect. All right. So you haven't had any anxiety since you added the gabapentin?
Not debilitating. No, no. I am living life again.
Well, and the other question is, oh, I mean, the fact that you've been pregnant and you're like fine in your pregnancy with no anxiety. I mean, part of me says part of that cocktail is all your hormones for pregnancy.
Right. Exactly. Exactly.
Like
And that's why
it
I would like to get off of this, just to see
I
if
know,
the hormones make it regulated or.
I know. I'm kind of going like, how do we know if the gabapentin did it or just being pregnant did it?
Hmm.
We
Right.
don't know. We don't
We
know.
don't. And I've been turned down by numerous midwives because of the
Yeah, all the
medicine.
meds. Yeah, yeah,
So
they're
it's been very difficult. That's
right.
been the difficult part.
Oh man. Oh my gosh. Yeah, I mean, I'm sitting here and I'm actually thinking, I doubt that you got pregnant because you got on gabapentin. I think you just happened to get pregnant when you started the gabapentin.
Uh-huh.
And um, so that makes me think the reason you've been feeling fantastic is because the change in your chemistry
Hmm.
has somehow interfered with whatever triggered you to have these anxiety attacks.
I would believe it. I believe that.
Like, and here's why I would say that. I would say just from a conditioned response type of approach, um, you have never been pregnant, right?
Never.
Right. So all of a sudden you're pregnant and you're completely different. Your life is completely different than age 25
Yes.
because you're pregnant. Like all of a sudden I'm going to have a totally different life with a child. And so whatever happened at 25 is kind of like totally like it's not a part of being pregnant because I wasn't pregnant then.
Right. Yeah, that's a totally different part of my life.
That is insane.
Yeah.
Wow,
Yeah.
you got a lot of decisions to make.
I do. I do.
Well,
That
and
causes anxiety, but it's manageable.
it's
That
like for
anybody would feel that.
well, I'm thinking you've been feeling so good. Um, well, I would say, so wait a minute. So you're 8 weeks pregnant, but you've been
Mhm.
taking the gabapentin the same length of time, or
I would say maybe a couple weeks before I got pregnant, I started the gabapentin.
so as soon as you started the gabapentin, did you feel better?
Yes, the day after.
Oh, wow.
Yeah.
Wow.
Yeah, I immediately. I felt beforehand I was physically vibrating every minute of the day,
Wow.
just vibrating with anxiety about anything, about everything.
And
And
you were on two meds and they didn't bother
mhm,
to say, let's get rid of these because they're doing nothing.
no, they just said, let's add this to it and see if it gets better.
Yeah. Yeah, that's what they do.
I would
That is
love to not be on these.
that is how to practice medicine in
Yeah.
2020. Actually, in
For the
1990, that was how it became to practice medicine. All
yeah.
right, so we're going to start by saying on a scale of 1 to 10. So, well, since you don't have the symptom right now, what I'll ask is we have to go into your memory. So we're going to
Mhm.
mess with your memory. So your memory of the debilitating anxiety where your whole body would vibrate and you really couldn't think, and did
Mhm.
it feel like a fear response?
In a way, it was a fear of letting everyone down, but I wouldn't say it's a fear. It
But
was,
I mean, if
I wasn't
if
scared.
in your environment it wasn't fear, so in your
Mhm.
environment, if like a great big monster came, it wouldn't
Yeah.
be the feeling. That would not be the
No,
feeling. Okay,
no.
so
We're in a
it's
very
more.
comfortable home, comfortable environment.
So, but
Yeah.
I'm saying is for yourself, the debilitating anxiety. Right. you were having it even though you were in a comfortable place.
Yes.
But my point is, what in your environment would have made it make sense? That's why I said, would a monster match that feeling? Like, what could have happened in your environment that would have made it make sense?
I honestly don't know.
You don't know.
I don't know. It's a habit, I think. I was so used to being anxious about everything.
Wow. And did your anxiety go in your body or in your mind or both?
Both.
Okay. All right. So on a scale of 1 to 10, with 10 being really unbearable, like when your debilitating anxiety was its worst, was it a 10?
It was a 9.
Okay. I'm going to put 9 to 10. And then is there a elation? No. All right. That means that you actually are getting some feedback or something good out of being that way, but you don't have that.
No.
And then stage of healing, 2, anger. So the stage of healing you're in is 2, which means it's anger. And then I can show up, I can pay attention, I can tell the truth, I can let go. Oh, you got all that going. That's really good. So good. All right. So the stages of healing are denial. That's when you say, this will go away. It's all normal. It's just a brief thing, and then it never goes away. And then anger is where I am so tired of this. Why isn't anybody fixing it? I can't take it. I hate it. I hate it. I hate it. And then the third thing is bargain. Okay, fine. I'll take the antidepressant. That didn't work. Okay, I'll take the anti-anxiety. So that didn't work. So you're bargaining your way. And then finally they hit the gabapentin. And then you have this wonderful event of pregnancy come along at the same time. It's like, why? Yeah.
Been a lot.
So then after bargain is depression, where the person says, you know what, I'm just going to have to live with all these drugs because this is how, it's the only way I can get by. And now I have to take care of a baby and I don't know what I'm going to do. And I'm just hoping the baby's going to be okay with this. So you're still kind of in that place, even though you're not anxious.
Exactly. It's constantly there. Just not debilitating, nothing like that. Just very much. What is happening every single day as this baby develops? Is the medicine hurting? I don't know. I have no idea.
Right. So, all right. Right. Well, we know it's not good for the baby, but the baby will be born and be fine. So yeah, and there's lots of studies on that, but it's not enough for them to stop the medicine.
Exactly.
Because they're weighing the pros and cons. Oh, well, what's a little, depression in a toddler? I mean, it's really weird. Or maybe I'll have an anxious little baby,
Right.
But maybe it would have been anxious. My baby would have been anxious if I didn't have these meds and I was anxious.
Exactly.
So there's a lot to weigh there.
Or what if I never even got pregnant? I don't know.
Yeah. So we're going to do stage 2. How many issues? So I'm asking your body how many issues, and I use muscle testing. If we were in person, I would push on your arm like that.
Okay.
And you would feel the muscle go weak. So when I'm doing remote, I use my own muscle, my finger. So, and I go through a series of questions to see if they resonate with your energy or your body. So stage 2, how many issues? 2, first one, current self, grief, my grief. So I feel grief. So we're starting with an emotion. I feel grief with a friend, male friend, family member, male friend. All right, so whatever happened when you were 25, did it involve a male friend?
Yes.
Okay, let me see, what's his name?
It was Braden.
It's Braden. So I feel grief with Braden. Is it my grief? Oh, good. It's Braden's grief. I feel Braden's grief. And
are you a psychic?
No. I'm muscle testing. So I feel Braden's grief and it's like, yeah, and it's this 25. And the only reason I went there is and normally I wouldn't, and I'm still going to look for something earlier. The only reason I asked that is because that it started then. That's the only reason.
Right.
So, all right. So I feel Braden's grief at 25. Let me ask, what was Braden grief about?
His brother passed away.
Was it expected?
No, it was unexpected
So it was
and
a tragic, unexpected
an
loss.
unexpected loss, and 10 years before his baby sister passed away. So it was a double, it was a reoccurrence. He felt it before and it happened again, and he felt helpless, basically.
Right.
Right.
So, and he would have been maybe 15 when his sister died.
Yeah, he was, yeah, that's spot on.
So, I mean, because you were both probably 25. I'm just making a
He
guess
was a
there.
little bit older, yeah.
So so his sister died. How'd she die?
She died of pneumonia when she was 3. They
Oh my
they
gosh.
were, yeah, playing in the river, and something, she got sick, got a bug, ended up in the hospital and passed.
And so that was unexpected.
Very unexpected.
So then what did how did his brother die?
His brother was in a car wreck. We were supposed to have a double date with him that evening.
Oh my
We couldn't
gosh.
we couldn't get a hold of him. His name was Brian. We could not get a hold of Brian. So we started driving. We knew he was hunting. We knew he was hunting that morning. So we went and tried to find him. And when we were turning around because we hadn't found him, my dad called. My dad called me and told me what happened. So I then had to tell Braden what happened. I think that's part of what I've been holding on to.
So, oh my gosh. So how in the world you had never ever had to tell anybody that somebody died,
No, no.
and you had to be the one to tell him.
Hmm. Yeah. Yeah, I had to, he, when I got off the phone, he knew something was wrong. So he was driving. I made him pull over, and then we both got out and I told him.
Oh man.
Yeah.
Did you have to drive after that?
Yes, I drove us home. Yeah. And we were about 20 minutes from the house. So
Wow. So are there other kids in the family?
there's 2 remaining children. Yeah. There's 4 total.
So there was, oh man. So there's Braden and another
And
brother
his
or sister, a sister. Wow. So
Yeah,
Braden was older than Brian, right?
correct.
Is he the
Brayden was
oldest one?
the oldest, and then Brian, and then Brooke, and
Wow.
then yeah.
Oh my gosh.
Yeah.
Okay. Uh,
Yeah.
so is Braden still in your life?
No, neither are. No, he's. I still hear of him
Yeah.
because my parents still live in that same town, and they're both friends with that family.
Yeah.
But I don't talk to him. No, no
So
need.
how long were you together after that?
We were together for about 4 years.
After this accident?
And it was rough. I tried to help him, and I was no help, of course. And
Wow.
yeah, his
So
sister Brooke,
did he just really have like some real bad coping mechanisms after this happened?
very bad, very bad. He basically became an alcoholic.
Oh,
I would be pulling him out of bars at night.
yeah.
I just didn't want to give up on him because he was going to school for nursing and had a good track going, and
Right.
just it fell off. His sister Brooke, I
Yeah.
mean, she mourned for a year or so, and she
Yeah.
still is, but she's successful. She moved on. She
But as far as you
has
know,
a family now, and
Braden
Braden
can't
still
get it
doesn't.
together. Well,
No,
he
still,
might have seen himself in the family as the person who protected everybody and kept
yep,
them together.
yep,
And he
yep.
failed.
Yeah,
I mean, in
that's
his
it.
head. Yeah. So, all right. So I feel Braden's grief when I'm 25 because because his brother died,
Hmm.
and it's like his sister died too.
Yeah,
Yeah,
all
because
over again.
yeah, people he loved and wanted to protect died.
Hmm.
Yeah. So emotions. Okay. So is this yours? It's somebody else's. Oh man. Okay. All right. So I'm gonna do. Um, this is grief. So normally I would be using magnets on you if we were in person, but because we're not, we're going to do a hand. So I need you to put a hand over your lung
Okay.
and a hand over your forehead. And then we're just going to think about how sad this was, how the grief, and it's really more of his grief that you kind of absorbed or took on. So breathe in and breathe out. And breathe in and breathe out. And breathe in and breathe out. All right, I want to ask, are there any other emotions? Is there an earlier time? Wow, you know what? This is awesome. You can bring your hands down. So the other question I asked your body is there an earlier time where you went through a similar kind of thing? And I got no. This is the first time. So it means that there wasn't some big loss in your childhood that this triggered.
I don't think so. No.
No, there's nothing.
No.
Like I don't get anything. And even some people will have like an in utero type of loss where they lose a twin that they don't even know. You don't even have, you don't show up with that. So this is awesome for you.
Good.
You could
Good.
have this great pregnancy. You probably could, yeah. Yeah, I have to be very careful because I'm on the record here. I can't speak to your meds, but I have a lot I could say. Anyway, I'm
No,
not
I
allowed.
understand.
I could
I'm on your
say
same
what I
side.
would Right, right. So, yeah, I just want to say this isn't going to be as hard as everybody thinks it is to get off
Okay.
of those. That's what I
Okay.
want to say. It's not going to be as hard or as scary. You're not going to like dip down into some weird thing. It's not, no, I don't think that's going to, just telling you. All right, so you're not crazy. How about that?
Thank
Any
you.
other emotions? Yeah, forgiveness. Okay, heart. Okay, so now I need you to rub these. There's 2 points under your collarbone, like here's your collarbone, and you're just gonna rub those points, and I'll rub them here as well. And if we were together, I would rub these points for you so you could just sit there, but you're gonna have to do your own.
Okay.
All right. So and these are called fear release points because when you start to change a memory that is locked into your brain and your brain is like messed up with,
Okay.
your brain gets a little scared that anybody's messing with that memory and it'll freeze. So we hold these points because these fear release points allow us to keep going deeper into your mind to help your mind resolve what needs resolved so it can move on. All right. So I need you to say, I forgive myself for believing
I forgive myself for believing
that I can't love Braden
that I can't love Braden
without taking on his grief
without taking on his grief
because his brother tragically died.
because his brother tragically died.
And then breathe. I forgive myself for believing
Forgive myself for believing
that I had to take on Braden's grief
that I had to take on Braden's grief
and carry all of that grief
and carry all of that grief
so that Braden would be okay.
so that Braden would be okay.
So that he, yeah, so he wouldn't cope in unhealthy ways.
So that he wouldn't cope in unhealthy ways.
So that he would reclaim his life.
So that he would reclaim his life.
And then breathe. Yeah, I forgive myself
I forgive myself
for believing
for believing
that letting go of Braden's grief
that letting go of Braden's grief
and the energy of this tragic trauma
and the energy of this tragic trauma
would not be good for me
would not be good for me
or Braden.
or Braden.
And then breathe. I forgive Brian
I forgive Brian
for losing his life in this tragic way.
for losing his life in this tragic way.
And making it so I would have to be the one
And making it so that I would have to be the one
to tell Braden what happened.
to tell Braden what happened.
And then breathe. What happened in the wreck?
He was going to pass somebody on the left side, and there was 2 cars in front of him, and the second car went to pass also. So they both went off into the ditch, and the ditch is, there was no
And he was
no
the only one
edges.
he was the only one in the car?
Yes.
All right. So I forgive Brian
I forgive Brian
for accidentally killing himself.
for accidentally killing himself.
And then breathe. I forgive myself for believing that Braden will kill himself.
I forgive myself for believing Braden might kill himself
If I don't take all this on,
if I don't take all of this on,
if I don't carry the trauma
if I don't carry the trauma
and the anxiety
and the anxiety
that Brian felt
that Brian felt
in his moment of death.
in his moment of death.
And then breathe. I forgive Brian
I forgive Brian
for believing
for believing
that he still has to say something to Braden
that he still has something to say to Braden,
and that he has, yeah, and that that he didn't die that day.
that he didn't die that day.
And then breathe. Yeah. I forgive Brian
I forgive Brian
for believing that, wow, that he still has to finish something with Braden.
that he still thinks he has something to finish with Braden.
And then breathe. Wow. And I'm the only one listening. Say that. And I'm the only
And
one
I'm the
listening.
only one listening.
And then breathe. Wow. I give Brian permission to accept.
I give Brian permission to accept
You really did die that day.
that he really did die that day.
And it was tragic.
And it was tragic.
And there was nothing he could have done to prevent it.
And there was nothing he could have done to prevent it.
It really was that easy, Brian.
It really was that easy, Brian.
And I forgive you.
And I forgive you.
And breathe. I forgive myself
I forgive myself
for believing
for believing
that I have a problem with uh, with debilitating anxiety
that I have a problem with debilitating anxiety
that makes me feel like I could die
that makes me feel like I could die
when I really have a problem
when I really have a problem
with an old memory.
with an old memory.
I pray over that memory.
I pray over that memory.
I love you, God.
I love you, God.
I'm sorry.
I am sorry.
Please forgive me.
Please forgive me.
And thank you
Thank you
for the life
for the life
and friendship
and friendship
I got to have with Brian
that I got to have with Brian
and Braden.
and Braden.
And breathe.
Yeah.
Wow. Oh my goodness. These. Okay. I give Brian permission
I give Brian permission
to forgive me
to forgive me
for not realizing
for not realizing
that I was supposed to tell Braden something.
that I was supposed to tell Braden something.
And then breathe. Yeah. I give Braden permission to accept.
I give Braden permission to accept.
Brian is sorry that he died,
Brian is sorry that he died,
and it's not your fault.
and it's not your fault.
And Brian wants you to be happy.
And Brian wants you to be happy.
Brian doesn't want his accident to ruin your life.
Brian does not want his accident to ruin your life.
And Brian loves you deeply.
And Brian loves you deeply.
And Brian will meet you again.
And Brian will meet you again.
Much, much, much later.
Much, much, much later.
When it's your time.
When it is your time.
Yeah. I say yes
I say yes
to the trauma,
to the trauma
energy,
energy,
the debilitating anxiety,
the debilitating anxiety,
and the fear that I'm going to die.
and the fear that I'm going to die.
I call it up.
I call it up
And I release it
and I release it
to God's love and mercy.
to God's love and mercy.
And breathe. I give Brian permission
I give Brian permission
to go into the light
to go into the light
where I will follow much, much, much later.
where I will follow much, much, much later.
I give Brian permission to accept.
I give Brian permission to accept.
There is nothing you could have done
There's nothing you could have done
that could have prevented this tragic loss.
that could have prevented this tragic loss.
You did everything you could have done.
You did everything you could have done.
And yeah, and there was nothing else left to do.
And there's nothing left. There's nothing else left to do.
And then breathe. I forgive Braden
I forgive Braden
for blaming himself
for blaming himself
for an unavoidable accident,
for an unavoidable accident,
a tragedy
a tragedy
with his sister and his brother.
with his sister and his brother.
And then breathe. I forgive Braden for believing
I forgive Braden for believing
that he would rather die
that he would rather die
and ruin his own life
and ruin his own life
than live with the loss of his brother and sister.
than live with the loss of his brother and sister.
And then breathe. I give Braden permission to accept,
I give Braden permission to accept,
even if you spend your life destroying your life.
even if you spend your life destroying your life.
You can't bring your brother and sister back to life.
You cannot bring your brother and sister back to life.
And you can't honor their life, their
And you
lives,
cannot honor their life
by destroying yours.
by destroying yours.
And breathe. I say yes
I say yes
to all the energy of blame and shame
to all the energy of blame and shame
that Braden took,
that Braden,
internalized in his life.
internalized in his life.
And I ask God to release it
I ask God to release it
on Braden's behalf
on Braden's behalf
from his body, mind, and spirit,
from his body, mind, and spirit,
so that he can live his life
that he can live his life
the way Brian would want him to.
the way Brian would want him to.
And breathe. I forgive myself
I forgive myself
for not knowing how to help Braden
for not knowing how to help Braden
or what to say
or what to say
or how to give him a message from Brian
or how to give him a message from Brian
or that was even possible.
or that was even possible.
Yeah, I forgive myself
Forgive myself
because I know
because I know
I did the best I could do.
I did the best I could do.
And then breathe. I forgive Braden
I forgive Braden
for giving up uh,
for,
all responsibility in his life.
for giving up all responsibility in his life
Um, because of the death of his brother.
because of the death of his brother.
Because of his fear that when he's responsible, bad things happen.
Because of his fear that when he is responsible, bad things happen.
People die.
People die.
Then breathe. I ask God
I ask God
to open space in Braden's heart
to open space in Braden's heart
where he can remember
where he can remember
how, how good he is at taking responsibility.
at how good he is at taking responsibility.
And he can let go
He can let go
of the things that he cannot control.
of the things he cannot control.
And and then breathe. I forgive Braden
I forgive Braden
for trying to numb up all the pain
for trying to numb up all of the pain
and for rebelling against God out of this shame and irresponsibility.
for rebelling against God with his
Out of,
shame and responsibility
instead of receiving the gift
instead of receiving the gift
of love
of love
that Brian and his sister have for him.
that Brian and his sister have for him.
And then breathe. Ah, so good. Ah. So I need you to say, without this pattern,
Without this pattern,
I am free
I am free
to accept
to accept
yeah, how I felt Brian's debilitating anxiety and fear of death.
how I felt Brian's debilitating fear of anxiety and death.
And fear of death.
It is fear of death.
Because Braden wouldn't feel it.
Because Braden would not feel any.
Yeah. And
Yep.
then breathe. Oh my goodness. Without this pattern,
Without this pattern,
I am free
I am free
to love and honor Brian.
to love and honor Brian
By letting him go.
by letting him go.
And by living my life
And by living my life
in gratitude.
in gratitude.
Yeah. For him.
And for him.
For how he tried to reach out.
He tried to reach out.
And none of us knew what was happening.
None of us knew what was happening.
And now I know.
Now I know.
Yeah. And then breathe. I give Brian permission to accept.
I give Brian permission to accept.
It's okay
It is okay
to go into the light.
to go into the light.
Car wrecks can make you feel really bad.
Car wrecks can make you feel really bad.
But I don't blame you, and neither does Braden.
But I don't blame you, and neither does Braden.
You're forgiven,
You are forgiven,
and you are remembered in love.
and you are remembered and loved.
Yeah. Wow. So I need you to say this to Brian. Brian, you may have already told Braden this, but I don't know if you did. Brian, I will tell Braden how much you love him.
Brian, I will tell Braden how much you love him.
I will make sure he knows
I will make sure he knows.
that you don't blame him and that you love him.
And that you don't blame him and you love him.
And that, wow. And then he was the greatest big brother ever.
That he was the greatest big brother ever.
Breathe. Oh, yes. All right. So, how are you feeling?
I feel good. I feel good. Yeah.
Can you think about how do you feel when you think about the circumstance of having to, getting the phone call and telling Braden? Does it feel a little lighter or different?
Yeah. Yeah, it feels like it happened the way it was supposed to happen.
Oh, good. And you're not like, it's not like overcoming you emotionally. Because when we just brought it up, you were pretty, so that's lightened up. It's not pulling anywhere.
No, yeah, it's lightened up.
Yeah. So I'm going to tell you that you can, you don't have to call Braden. You don't have to send him a message. You can send him a message this way.
Okay.
So, I mean, I would say that when you feel that anxiety, the conversation would be, I hear you, Brian. I'm gonna, I'm gonna let, I will let Braden know
Okay.
the greatest brother, that he's the
Okay.
greatest brother in the world, and that you want him to know that.
Okay.
So it's like you saying that will, like, you'll find your anxiety go down. It's almost like that overlay of anxiety and the like, I just wish I was dead. It's so it won't go away. It won't go away. It's a feel
Right,
like
right,
I'm gonna die. Is
right.
straight up. It's straight up Brian reaching out is what that is.
Okay.
I don't believe it's your anxiety, and it never was, which that actually makes sense given your history up until that point. It's
Right.
just, and then you got in this really weird emotional circumstance, and everything, how you were holding things kind of
Right.
froze,
Yes.
and you couldn't tell. I mean, who's gonna know? Oh, this anxiety is the guy, this goes with somebody who's in a car wreck.
Right, right,
I was trying to come up with what would be in your life that would actually match it. We can go there. And then I realized,
right.
oh, it's, you haven't been in a car wreck that was this bad. So you're like, I
No.
don't know. I've never felt this. Yeah. Now you
Right.
know what it feels like.
Whoa.
Yeah.
Wow.
Yeah. So,
Wow.
yeah. So I want to say, oh wait, so stage of healing, 7. You're stage
Wow.
7, which is creation of new life, which is right where you're
Okay.
at with the baby. And then subjective unit. So now I want you to think about, yeah, like when this anxiety is its worst in your memory. Does it still reach up to a 10 in your memory?
In my memory, it does.
It does? Okay.
Yeah.
So I want to lower it a little bit in the memory again. So we're going
Okay.
to go, because that could be the habitual, the habit.
Okay. I
Is
think
it
so.
grief? It's grief. It's ah oh goody. It's Brian's grief. It's not Braden's. It's Brian's grief. All right. Thanks, Brian. You just need so much work here today. All right. All right. I need any other emotion. So Brian's grief is what's there because he died. Is it because he couldn't say last words? He didn't get to say goodbye.
Right.
Yep.
He didn't.
So heart, yeah, huh?
They say he didn't.
No,
He
he
didn't
didn't
get to
get to
say
say
goodbye.
goodbye. That's a big deal. All right, so I need you to say, I forgive, I love and accept myself,
I love and accept myself,
even though
even though
in my memory I'm still feeling
in my memory I'm still feeling
anxious grief
anxious grief
that Brian felt
that Brian felt
because he didn't get to say goodbye.
because he did not get to say goodbye.
And then breathe. Yeah. I forgive myself for believing
I forgive myself for believing
that, yeah, I have to feel Brian's grief because I didn't get to say goodbye.
that I have to feel Brian's grief because I didn't get to say goodbye.
And then breathe. I forgive Brian for not getting to say goodbye
I forgive Brian for not getting to say goodbye.
or for saying goodbye in this weird way.
For saying goodbye in this weird way.
And then breathe. I give Brian permission
I give Brian permission
to let go of his own grief
to let go of his own grief
over dying and not even getting a proper goodbye.
over dying and not getting to say a proper goodbye.
I give you permission to let it go. Let the
I
grief
give
go, Brian.
I give you permission to let it go. Let the grief go, Brian.
We forgive you.
We forgive you.
And I accept your goodbye.
And I accept your goodbye.
on behalf of everyone,
On behalf of everybody,
I accept it.
I accept it.
Your goodbye means a lot,
Your goodbye means a lot,
and it's okay for you.
and it's okay.
Yeah, there's enough closure for you to go into the light,
There is enough closure for you to go into the light,
and you can meet your sister there.
and you can meet your sister Sarah there.
She's so ready to see you
She's so ready to see
because you're a great big brother too.
you, because you are a great big brother.
Yeah, breathe. Oh goodness,
I felt that.
that feels really good. Yeah,
Yeah,
I like this Brian because he's not like leaving until he said everything.
he's a good
Well,
one.
well, and I feel like even your crying was actually him crying for his own life and what
Yeah.
he didn't get and how it lost. It's like his own regret.
Yes.
Yeah. All right. So now I need you to, well, I need you to say, without this pattern,
Without this pattern,
I am free.
I am free
Just to remember Brian
to remember Brian
with gratitude
with gratitude
for the great person he was
for the great person he was
and the good little brother to Braden.
and the good little brother to Braden.
And that even in death, he wanted to say goodbye.
That even in death, he wanted to say goodbye.
And then breathe. Yes. Whew. Of course, being pregnant is going to like amplify all the tear feels. I love it. You're like, oh. Okay.
Yes.
All right. So now I want you to think about the memory, like what happened to Brian, this terrible accident that he didn't make it in, and then you had to tell Braden. So the memory, is the memory, like think about like how bad it feels. Is it still like a 9 or 10?
No, I'd say it's about a 7.
Yeah, it went down. Yeah.
Yeah.
All right. That's not low enough for me. All right. We still got a little time here. So can we lower it again yet? Family, self, grief, my grief. This is my grief. I know what this is. This is my grief with myself because my guess is going to be, I'll muscle test to see if it's right. If I'm wrong, and you'll just have to give me.
Okay.
My grief with myself is because I have spent this many years with this terrible symptom and not knowing what to do.
Yes.
And it has robbed me of some of the best, some good things I could have had in my life.
Yes.
Is that it? Yeah. My
Yeah.
grief because I feel like such a loser for having this problem in my life. And now I'm on
Yeah.
3 meds and I don't even like meds.
Exactly.
I want to say, I'm a home birther for God's sake. This is not my story.
Exactly.
So my
Exactly.
grief because because I have had this anxiety and not known what to do with it.
Yes.
Yeah. Had anxiety. Yeah. So is there an earlier time? No, this is just you like accepting the loss of 4 years to debilitating anxiety and 3 meds.
Yes.
All right, heart. Okay, so you're gonna rub here again. So I need you to say, I forgive myself for believing
I forgive myself for believing
that that I have to feel anxiety and grief
that I have to feel anxiety and grief.
because how many years? 4 years, 6 years?
6 years.
Ah, because for the last 6 years, I didn't know what to do with myself.
I have not known what to do with myself for the past 6 years.
And I have harshly judged myself
And I have harshly judged myself
and blamed myself
and blamed myself
for symptoms that I couldn't manage
For the symptoms I could not manage
without medication.
without medication.
And then breathe. I forgive myself
I forgive myself
for holding on to all the years I could have had without anxiety
for holding on to all the years I could have had without anxiety.
that don't exist.
They don't exist.
I let go
I let go
of the life that I wished I could have had over the past 6 years.
I've let go of the life I wish I could have had over the past 6 years,
Where I figured this anxiety out and it went away,
where I figured this anxiety out and it went away.
and I didn't have to take medicine and feel like a crazy person.
I didn't have to take medicine and feel like a crazy person.
Instead of this seriously empathic person with those who've passed on.
Instead of the seriously empathic person with those that passed on.
Passed on, yeah, and then breathe. Yeah. Oh, this is good. There's a lot of that life. I let go
I let go
of the life
of the life
that I didn't get.
of the life I did not get.
The one where, the one where I'm perfect. I figure everything out, and I never think I'm crazy.
The one I think
Where
I'm
I'm
perfect.
perfect. I figure everything out.
And I figure everything out and I'm not crazy.
Yeah, and then breathe. Yeah. Without this life that doesn't exist,
Without this life that doesn't exist,
I am free to show more compassion for what I've been through.
I am free to show more compassion from what I've been through
And how it has led me
and how it has led me
to the reality
to the reality
of a gift I didn't even know I had.
of a gift I did not even know I had.
Apparently, I'm very attuned with people who die.
Apparently, I am very attuned to people that die.
Yeah.
I am.
Yeah. And then breathe.
Yeah.
Okay. And with that knowledge,
Wow.
yeah, yeah, I'm not a crazy person.
I'm not crazy.
It's just that the gift I have, yeah, it seems crazy to a lot of people.
The gift I have seems crazy to a lot of people.
Yeah, and then breathe. But there is good work I can do with this gift,
There is good work I can do with this gift,
like I did today.
like I did today.
I finally recognized Brian was calling,
I finally recognized Brian was calling,
and I wasn't crazy,
and I wasn't crazy.
and I probably don't even need medication,
And I probably don't even need medication.
because it might actually block this gift.
It might block this gift.
Because now I know
Because now I know
when I'm feeling something that doesn't make sense to me
when I feel something that doesn't make sense to me
and my life and my experience,
in my life and my experience,
I can uh, I can go deeper
I can go deeper
and look for the message I'm supposed to give to somebody
and look for that message that I'm supposed to give somebody.
and promise I will give it.
And I promise I will give it.
And then the weird feeling disappears.
And then the weird feeling disappears.
And yeah, and then breathe. Oh, that was good.
That was good.
Ah, so good. Okay.
That one was good.
Did you know
Wow.
you do that?
I
Did you know that
feel
before?
like I've felt that before, and it's not
Okay.
been, when I feel it with other folks, it's not been so negative.
Right.
So
So I
this,
guess what I'm saying is I'm asking because most people who have this ability, they know. They just don't talk about it and they don't know what to do with it. And they
right,
kind of just go, ah, what's this?
same,
Like a toy they don't know what to do with.
right,
Um,
right,
but yeah, okay. So we're going to go back to the memory of the anxiety, the debilitating anxiety, because I don't want it to have to come to you that way, this gift.
right.
It shouldn't have to do this to get my attention
Okay,
because I could just acknowledge like, oh, somebody died and I'm really good at tuning into that. I can get the message before the person starts yanking on me and making me feel crazy. Then I
okay,
forget that, wait a minute, this isn't me. This is the dead person who's trying to get my attention. Um, so that way it gives you a little more of what you can do with it, like to know I'm sensitive to people who have passed away.
uh-huh.
And I mean, you're so sensitive, I can tell you this, that if you're talking to a stranger and they tell you, oh yeah, I just lost my husband, you could give them a message from their husband.
Okay, I believe that.
You listen, you will know what that husband, the husband will be like,
Yep.
and you'll feel like when you sense that, you will feel really crazy and silly.
Hmm.
You'll feel like they're going to think I'm nuts. And I'm going to tell you, you just need to say, I'm just getting this really strong feeling that I want to tell you that your husband wants you to know this.
Yeah.
And you just tell them. I
Hmm.
don't even explain you just go, this is going to seem crazy, but your husband wants you to know this. And that's just coming to me and I need to tell you.
Okay.
Because if I don't tell you, your husband and all his symptoms might show up in me. No thanks.
True. True.
Yes.
True.
But I'm going to tell you that it's not a hit and miss. When you do that with someone, they will burst into tears.
Yeah.
They will be like, thank you. How did you know that? Who are
Right.
you? You'll be thinking, this is crazy talk I'm doing. How am I knowing this? But
Right.
they will have some healing response to it that will change their life. So anyway,
I
just
didn't
saying.
realize it. I didn't realize anxiety was that in me. I felt like I had a different kind of channel with the dead, but I didn't know that's what anxiety was.
Right.
That opened my
Well,
eyes.
and the purpose of it, I mean, I want to say the purpose of it, it's when you're resisting it and you don't want to know, like it's a weird idea to say I all of a sudden have this thought and idea of what somebody needs to tell somebody because this person is dead. Like
Hmm.
why am I having this thought? This is, you know, I don't know, necromancy or something, it's like weird.
Right.
Um what I feel about it is this, when I believe that words heal people.
Hmm.
And that when you are given this kind of it's a word of knowledge, and it's a word of knowledge about someone who has passed away, and
Uh-huh.
it makes all the difference. It's like God wants this person in front of you to have this shift,
Hmm.
and you have a gift that allows you to say the words that they need to hear. So
Yep.
yeah. So I mean, I say that because some people, when you start saying, oh, you're talking to dead people. Oh, that's wrong. That's bad. Well, actually, God isn't limited by who he might use. And if he gave me the gift to say the words that help this person move forward and become better as who they are for God and their community and the world, well, I wouldn't call that, this is not what people typically are afraid of. This isn't a seancey thing.
Right. Right. That makes sense.
So I say that for anybody watching who's a little scared about this topic. Don't be. It's like if it shows up, it shows up.
Yep.
I've
It will
learned
slap
to.
you in the face.
That's
It'll
right.
show up.
It will. It is, and those who are listening and paying attention, they like you. They like start to get better at knowing this isn't me. This is part of that gift in me, and maybe I'm supposed to share something with somebody, and so I got to figure out what that is.
Right.
Um,
Right.
But like I said, it could be a stranger that you're talking to, you just met, and, you know, they tell you their husband passed away, or they tell you 14 years ago their adult son drug overdosed.
Right.
I
Right.
mean, and they're telling this because the wound is still like there with them, and they haven't moved on. And when you can say the closure words from the person themselves, because it's really resonating in that person you're talking to, they just can't see it because they're so full of
Right.
grief.
Right.
I mean, you changed that moment. They will never forget you. They will
True.
say, some lady came up to me and just told me what I needed to hear.
Yeah.
Um, and you will be so much more accepting of who you are, and how you are with people. All right, so think about the anxiety in your memory. Is it still a 7? So think about like Brian's his car, his tragedy, and then you had to talk to Braden.
I feel a lot more calm about it.
So I'm gonna
I
test.
do.
Oh, I got that it's a 2. So it means that your subjective units of distress in the memory of this, what's really interesting to me about this memory is you're 25 years old, you've never done anything like this in your life. But it just so happens that you're the one who has to tell the boyfriend that his brother tragically died. That's
Right.
no accident right there.
It's
You
true.
were the
That's
one.
true.
Even though as a 25-year-old, you're like, I don't know what I'm doing. I don't know how I got, why me? Why me? It's
Right.
because you were the one who had the gift.
That makes sense.
You were just
I've
learning.
never, ever thought about it like that.
Yeah. Yeah.
Thank you.
So I'm going to tell you that, yeah, I think that you're going to feel a whole lot better overall. And that, I don't know who you can find that can help you to taper. I would say, looking online and seeing how people do these things, um, that's how people have to do it these days, because a lot of professionals won't step up who have the licensure and
Right.
help people with their tapering. So I have people who show up and they've done it themselves by going online and getting advice from other people who said, I don't want to be on this. How do I manage, and how do I see how this is going to work?
Okay. Yeah.
So I'm just, yeah, that would be the research I might do if I were you, because yeah, like
Okay.
I said, I don't have the licensure to tell you how to do that. It would be totally
Fair.
trouble for me.
Understood.
Yes. Anyway, thank you so much.
Thank
And
you.
I think you're gonna do fantastic. And for the record, I don't think you're crazy, and I don't think you are a person who should be living with medication.
I agree. I
that
agree.
that there is, yeah, that this is going to shift really quickly and should be good.
I'm glad I met you, Annette. Thank you.
Thank you for, what, your story is so unique, and I'm so grateful that you're allowing me to post it.
No, I appreciate you. Thank you so much for
All
the
right,
help.
and I hope you find a midwife. Having babies at home is amazing.
Yes, yes, yes. Especially
I
nowadays.
Yes, I have 5 babies. I had 3 at home, the last 3.
That's amazing. That's
Yep.
beautiful.
And it was, yeah, it's like the luxury of a lifetime to do it at home.
I can
Anyway,
imagine.
yep, yep. I'm
Thank you.
hoping you will find that person. I think you would do great.
Wonderful.
Maybe I
Thank
can
you
talk.
so
Yeah.
much.
You are so welcome. You have a great day.
You
Bye-bye.
too. Have a great rest of your day.
All right.